Hello, folks. We're just going to give it a couple more minutes and then we're going to start. Give people a chance to join in. Oops. Hit my mouse. Just another minute or so and we'll get going. One more minute. All right. Well, let's start. Pregnancy and early development. And how do mycotoxins affect this? Well, this is an evidence-based lecture, and what that means for those of you who may not know this is that evidence-based means it's not based on opinion or internet websites that say this and that and the other, and just this is based on medical and scientific evidence. So this is what an evidence-based lecture means. So a little bit, I'm the editor-in-chief of 4 medical journals, and I am also a reviewer and editorial board member on several other medical journals, and I'm the co-author of over 100 studies and published in medical journals and medical textbooks. I am considered knowledgeable with 100 publications, but there's a whole bunch of people on the internet who say they're experts because they have a website. Well, that doesn't make them an expert. So the information I give is to educate people, whether they're healthcare professionals or otherwise. I'm here to educate people. I'm not here to make a bunch of money or anything or to sell you something or anything like that. So, and this is the disclaimer that I'm not trying to give you medical advice or what to do and about medical anything. I'm going to give you the information. So this starts also with climate change. Why? Because climate change has affected us all over the planet. Okay, we've seen floods, we've seen storms, we've seen all kinds of droughts and lakes going down to nothing and everything. And so what happens with all the rains and floods and things is that besides the immediate effect, there's also the health hazard from mold in, water damaged and mold infested homes, schools, businesses, public buildings. And you'll see that in just a little bit on this webinar. So, but what is really important that with this mold growth, there's mycotoxins. And these are dispersed throughout a home, a building, a school, a business by airborne spores. And these spores, when these companies come out and measure spores, and they say you have so much spores. Well, you have at least 1,000 times more mycotoxins than you have spores. And this is all, again, medical and scientific evidence. So diseases associated with the exposure to mycotoxins are called as the great masquerader of the 21st century by the World Health Organization. This is because it comes in a lot of different disguises, involves different organs, and looks like different diseases like Lyme, like fibromyalgia, like chronic fatigue syndrome, sarcoidosis, autoimmune diseases like rheumatoid arthritis or psoriasis, skin disorders, etc., eczema, so on and so forth. But they're really caused by mycotoxins. That's why they're the great masquerader. Okay, so let's get into when a woman is pregnant. Pregnant women with a high risk of chromosomal abnormalities or anomalies or genetic fetal defects that are usually detected during the first trimester of prenatal screening. You know, you get the ultrasound, blood tests, etc. Then they remove amniotic fluid from the pregnant woman anywhere between 15 and 22 weeks of gestation. In 73% of these situations with fetal defects, 73% of the samples had mycotoxins, almost 3/4. So you can't ignore that, and it's an important cause. So going back to this, this is an important factor, and that's why this screening for pregnant women is so important, is to rule those things out, hopefully. So the first 1,000 days of life in a child, and I'm talking not about after birth, okay? I'm talking about fetal stage to 2 years old. That's when this child really has accelerated growth and development. And so therefore, the children are much more vulnerable to the toxic effects of mycotoxins as compared to, say, an adult, because they have lower body mass and they really don't have a good, mature detoxification system or method. And in pregnant women, fetuses and infants are newborn babies, they're particularly vulnerable to exposure to indoor environmental things, molds and mycotoxins, okay? And the other part is mycotoxins can cross the placental barrier. They, in the mother, they cross the placenta and affect the fetus. And after birth, breastfed infants can be exposed to the mycotoxins through contaminated breast milk. And for instance, ochratoxin. Ochratoxin is 99.8% bound to albumin. Albumin is the #1 protein in you. It cannot be excreted in urine, although if you order a urine test, they find it almost in everybody. Go figure. It cannot be excreted in urine. But here's the key: the plasma and blood serum is half-life is almost 36 days, 35 days, which is extremely long, and makes the testing in plasma or blood serum a good marker, good biomarker by blood serum antibodies, which MyMycoLab does. And it was found twice as high in the umbilical cord than in mom's blood. And it's also found in breast milk. So I'm giving you examples here so you become aware of the problems. And here's the effects in pregnancy and in infants. Okay, there's an increased risk in the mom for preeclampsia. There's an increased risk of low birth weight. So a baby weighs less than it should. And the adverse effects on growth during the first year of life doesn't grow as the baby doesn't grow as well. And during pregnancy, the mother, if she's exposed to molds and mycotoxins, it increases the likelihood of jaundice in the baby when it's born, more than doubling that risk. Okay. So from 6 months to 3 years of age, in a child, a baby, mycotoxins can cause growth impairment, abnormal weight for age, abnormal weight for the height, digestive problems, autism, ADD, ADHD, and later early thelarche, which is when a girl starts menstruating. So she starts menstruating much earlier, and there's precocious puberty. I can tell you of a case that was sent to me. I received a call from the head of the health department of a state in the United States. I'm not going to mention which state. They said they had, the head of the health department for that state, a medical doctor, said there's a case that we have had, and it's gone to the top medical centers here in our state, and we can't figure out what's wrong. And please, will you accept her as a patient, and etc. He had read I've got over 100 published studies. So he had read some of those and became aware that maybe I can possibly help this patient from his state. The patient was a 6-year-old girl. She had fully formed breasts and fully formed pubic hair, etc., and she was menstruating, 6 years old. Well, of course, she came with her mother, and the mother was baffled because they'd gone through pediatric endocrinologists and had MRIs and you name it. They had all the tests done that the state can do at their state supported medical center. And after quite a bit of going through her medical records, etc., I called the preschool that this little 6-year-old was attending, and the kindergarten. And I talked to the director of both and asked them if there was anything unusual in the school, and had they seen this with other students? No. Their answer was no. But what they did, and then when I asked them further, what about the teachers? Said that no. Well, we have had a situation because we have 5 teachers, all of them are young women under the age of 30, and out of the 5, 3 of them have had hysterectomies for excessive bleeding. So obviously there was a problem with mold and mycotoxins at that school, and this is where this little girl had that from. So let me go through this with you and understand that hair is 100 microns. The spores are 2 to 4, and mycotoxins are 0.1. What does that mean? It means it's the same size as a virus. Okay. By the way, have you ever seen any virus measured in urine? Of course not. Okay, so you can make your own conclusions. But spores being 2 to 4 microns, that means they go to the deepest part when you're breathing, deepest part of your nasal sinuses and lungs. Why? Because exposure is mainly to mycotoxins, is mainly by inhalation, absorption through the skin, but ingestion, oral, in other words, from food, is minimal. It is not in the gut, and I'll show you why. How do mycotoxins get into the body? They get into the body by nasal mucosa, lungs, and skin. And they attach to the nasal mucosa where they're transported through the olfactory nerve and enter the brain. In the lungs, because of the tiny size, they go into the deepest parts of the lung and go right to the alveolar parts, and they enter the circulation. So it's a very, how can I say this? It's a way that it gets into you and absorbed into the blood. So let's look at kids. Kids spend 89% of their time indoors, either at home or in school. But 50 to 68% of homes and 85% of commercial properties in the United States have water damage and mold growth. And don't forget that the child's immune system is not yet fully developed. And so the kid has symptoms that are not really specific. Conjunctivitis of the eyes, meaning red eyes, nosebleed, cough, wheezing, shortness of breath, okay, nausea, vomiting, rashes. There's been cases of acute pulmonary hemorrhage, bleeding into the lungs, and bone marrow failure, and recurrent shortness of breath, and pneumonia in medical journal articles. And so these symptoms are not like, these are what we call general symptoms. And so what happens is that in this study of 482 children, they did testing, psychometric testing, at age 4, when the kid was 4 years old, and almost 500 kids who'd been exposed to mycotoxins starting at 3 months of age because their home had dampness, mold, etc., in the child's bedroom. There was a significant decrease in the general cognitive score of these kids in 2 different types of tests: the McCarthy scales of child abilities and the California Preschool Social Competence Scale. Okay, so this is, and having said that, that's 500 kids. It's not a small, insignificant number. They really did a good job in this published study. And in children with long-term exposure to molds and mycotoxins, they have neurobehavioral changes. And these were significantly elevated. What do I mean by neurobehavioral changes? Learning disabilities, behavioral abnormalities, etc. Okay. So they had abnormalities on neurophysiological tests, including EEGs, brainstem evoked potentials, visual evoked potentials, somatosensory evoked potentials. So in a study of adolescents with exposure to molds and mycotoxins, 70% had abnormal brain EEGs as compared to controls. And the brainstem auditory evoked potentials were abnormal in 90% of the patients. This looks at the part of the brain that is linked to hearing, compared to none in the controls. And in visual evoked potentials, the results were abnormal in 40% of the cases. visual evoked potentials measure the optic nerve. So on another nerve, this is slide 2 of the same thing, the median ulnar and in the arms and sural nerve in the legs were abnormal in half the cases, as compared with none in the controls, meaning none in the normal children. These findings of this study indicated evidence of diffuse polyneuropathy, meaning nerve damage in many parts, indicating significant neurological deficits in all the adolescents. And are we having problems today with adolescents? We read about it almost daily in the news. So, going on with this neurodevelopmental problems in kids, they've connected mycotoxins and autism spectrum disorder. I can tell you that for the last 30 some odd years, I've treated autistic kids, and I got them back not all the way to normal, but to normal enough that they're going to school, normal school, regular school, not special school, that they interact with their parents, their friends, their cousins and whatnot, etc. Okay, but these mycotoxins, they dysregulate the immune system. That's well known, and they cause a secretion of pro-inflammatory cytokines, especially from mast cells. That's the IgE test that's done on mycotoxins by MyMycoLab. And exposure to mycotoxins can affect the nervous system both directly and also through stimulation of immune cell activation, which together contribute to the neurodevelopmental disorders. So we see a lot of, ask any teacher, and they'll tell you there's a lot more learning and behavioral abnormalities in children than there was before. So going back to the point that many children spend 80 to 90% of the time indoors, whether at home or schools. Schools are frequently contaminated by molds and mycotoxins. Why? Because they're built to the lowest bidder. Whoever bids the lowest gets to build the school. And teachers and custodial staff are affected as well in all this. Studies have shown that school buildings are particularly vulnerable to indoor air problems. Increasing numbers of teachers have had their health adversely affected by working in these schools. And there's increasing and growing documentation of teachers with occupational illnesses, meaning because they're a teacher, related to working in schools with successive respiratory diseases, sarcoidosis, and occupational asthma. Now you can imagine what that does for a teacher. So in the United States, OSHA, which is the Occupational Health and Safety Administration, estimates 15% of school children may be affected by exposure to molds and mycotoxins. Now, here's a study with looking at asthma from Harvard University. They looked at over 13,000 children, anywhere from ages 8 to 12, in 24 different communities throughout North America, and found, and so that these communities were not where there was a lot of industrial smoke or anything like that. They tried to get the average community. There was mold growth in 22 to 54% in the households with children with asthma. So anywhere, just in generalizing, from a fourth to half of those homes had mold damage and mold growth, and the kids, of course, had asthma. Now, I have to mention that regrettably, the symptoms that these kids, and including adults, affected by molds and mycotoxins, and they complain. I gave you the general symptoms. And the possible overlap with other diseases leave many of my colleagues, and I'm a medical doctor, to believe that there is no link between the exposure to molds and mycotoxins and immune and autoimmune response and disorders. This is unfortunate because the medical evidence shows that it does. There are links. But also, being very direct, as I always am, why do many colleagues stay away from molds and all this stuff? Because of all the false information and hype on the internet. And most of them involving some sort of an expert who's not really an expert. He's selling something to an unsuspecting public. This is what a patient wrote me. That these doctors, these so-called experts, should focus on getting it recognized and covered by insurance instead of simply lining their pockets, while people can't afford their pricey visits and testing and supplements. It's sad. I agree. Here's what somebody wrote me and sent to me. Hi, Doc. Listening to more of your videos, lectures, and interviews while now waiting for the antibody test I ordered from MyMycoLab. It is truly amazing how much misinformation is out there and how these mold treatment doctors put a slant on everything, which all leads to getting sucked into their treatments and tests. So true, unfortunately. Now, what happens if you are exposed to molds and mycotoxins? You have to apply the first rule of toxicology, which is get the patient away from the toxin or the toxin away from the patient. That's the first rule of toxicology. Okay, and which mycotoxins can be tested in urine? Cetotoxin, verrucorin, and verrucorol. Ochratoxin A and B, T2 toxin, vomitoxin, which is what it's called in Europe, but here it's known as deoxynivalenol. Cladosporium toxin, alternaria toxin, which is called alternariol, aspergillus hemolysin, stigmatocystin, mycophenolic acid, trichothecene, gliotoxin, etc. Okay, so this is what is available as being tested in the blood, and the blood doesn't lie. Okay, blood is not affected by other things. So the most precise and accurate tests for mycotoxins are antibodies, antibody testing from blood serum, and both IgG and IgE measurements of 12 different mycotoxins. You have 24 test results. Now, here's a patient. This is on the left is before her tests results, and on the right is after, and feeling good and healthy. She wrote, "Thank you for the gift of the mycotoxin antibody test, and thank you for the gift of health. So very happy to have met you. Old on the left, new on the right." So this is 6 months apart, which is pretty typical for treatment, not yours like all the others, so-called quote unquote experts. Now, mycotoxins that are in foods are excreted in urine. There's low levels of mycotoxins in many foods, cereals, beans, including coffee beans, fruits, grape juice, beer, coffee, etc. And this is known by the World Health Organization, United Nations, etc. And all of these are below TDI, tolerable daily intake. And for that reason, mycotoxins can be found in the urine of healthy people. There's many, many studies that show that it can be found in healthy people, but not in their blood. So having said that, The FDA in the United States sets the tolerable daily intake. The EFSA, European Food Safety Authority, does it. And then also the United Nations Food and Agricultural Organization, World Health Organization, blah, blah, blah. They all set these limits, and they're parts per billion. I asked the scientist, what is a part per billion? I'm a visual. Tell me what a part per billion is, please. And he says, well, imagine 100 football fields and cover them with golf balls, all 100 football fields. Take one golf ball away, that's 1 part per billion. Well, anyone who's listening, I'm going to tell you that that is a part that's easily excreted in urine. It's not, doesn't affect people. So this is a recent study 2 years ago, July, that milk, the kind you buy at the supermarket, okay, has 1 to 4 mycotoxins. 91% of all the milk you buy has anywhere from 1 to 4 mycotoxins. 30% had 2 to 4 mycotoxins, but all the mycotoxins level were well below the tolerable daily intake, which means they're easily gotten rid of by the body, as are most mycotoxins found in beverages and foods. Now, if you're not convinced, here's a study showing look at the last 3 lines. An adult weighing 170 pounds would have to eat 14 pounds of oatmeal that's rancid, smells bad, tastes awful, etc., or 20 slices of rancid bread to have them affected by mycotoxins. Nobody's going to have that happen. In children, a 2-year-old child with a body weight of 28 pounds would have to eat 38 ounces of oatmeal, okay, or 3.5 slices of bread. Okay, rancid. In looking at the urine versus the blood serum testing, urinalysis is easier to do, but it reflects day-to-day variations, and therefore samples should be taken. This is from medical studies. Samples of urine should be taken at different times over a 24-hour period for several days to be able to get the average. And urinary excretion of mycotoxins just indicate the mycotoxin intake, what you ate from food that day. It doesn't give you what you were exposed to in your indoor environment. Now, here's a study that was published in October of last year. What's that, 8 months ago or so? Okay, the variability of mycotoxin concentrations in urine demands urine sampling at different time points during the day. And because of various factors such as gender, age, diet, and muscle mass, it's not that accurate. But they go on to say the same study, the ELISA method, which is the one that's used by MyMycoLab to detect mycotoxins in human serum, comes with significant accuracy, precision, and specificity. So there you go. Now, tests that lack medical evidence. Urine testing for mycotoxins. The CDC says that it's not a validated test, should not be used for diagnostic purposes. The organic acid tests in urine for molds. Organic acid test is used in newborns, babies who have a genetic metabolic defect. It has nothing to do with molds. Then there's the famous HLA-DR genetic test. Let me tell you, folks, there's a website that say 25% of the population has this. Well, 25% of the US population is about 82 million people. But there isn't a single published study on this. No one's looking at it. The National Institutes of Health, the NIH, is not putting any money into testing people for this, yet it's supposed to affect 82 million. Folks, let me tell you of another disease that everyone has heard of that affects not 82, only 32, unfortunately 32 million, 50 million less. It's called diabetes. Everybody knows about it, but this one, 50 million people more, nothing. Then you have this visual thing, the MSH, C3A, C4A. Those are the C3A, C4A, MSH. Those are general tests in immunology. I'm a clinical immunologist. They just mean inflammation. What could it mean? You went out, ate too many tacos last night, or too much pizza, and your gut is having some inflammation problems from all the stuff you ate. Well, your C3A, C4A are going to be elevated. Doesn't mean that it's due to mold or mycotoxins. Binders. Well, they've done studies in pigs, rabbits, sheep, broiler chickens, ducks, turkeys, rats, mice. Oh, and pigs. And this is in laboratories with very precise conditions, okay? And they use specific binders, etc. And they work in these animals because they're farm animals. They're raised for farm purposes, not the rats and mice, but the rest. There's no scientific or medical published studies to support their use in humans. I don't treat pigs or sheep or ducks or anything. Now, the same study said, there's one study that says the binders rely on the absorption of mycotoxins from the gut, okay, to prevent it from getting into the blood, okay. And here are all the different types. They're effective in neutralizing only one mycotoxin, aflatoxin, which is rare. They're not ineffective in all other mycotoxins. In addition, they also bind vital vitamins as well as macro and micronutrients. If you don't agree, this study was published in 2019. You can publish your own study saying, I disagree, and here's why. No such study currently exists except for this one. Then there's a treatment problem. A lot of healthcare people are out there giving out fluconazole. There's two types of molds, single cell and multiple cell. Single cell are all the yeasts, and just like Candida and many, many others. And yes, for yeast, single cell, Candida, you treat with fluconazole. But for the multicellular molds, such as Aspergillus, Penicillium, Fusarium, Stachybotrys, etc., fluconazole doesn't work. Itraconazole does. And by the way, itraconazole also kills the single cell. So you're getting double the bang for your buck. Now, I thought this would be interesting for you to know. They did a study on 7 multi-center, meaning all kinds of cancer centers throughout the United States. And they had 17,401 patients. They took the tissue, the blood, and blood serum samples of 35 different types of cancer in these patients. Fungi, molds, were found in individual tumor types and contributed to carcinogenesis, in other words, the formation of cancer. And these were esophageal cancer, pancreatic cancer, breast cancer, lung cancer, melanoma, ovary, colon, brain, and bone cancers. And On top of that, itraconazole, which we just mentioned, also known as Sporanox, is a common antifungal agent that was developed in the 1980s. It has been in clinical use for 35 years with an established safety record. So for all of you who immediately go and look it up in Dr. Google, instead of in medical journals, they'll say, oh, it's going to do all this bad things to you. No, it's not. It has a 35 years established safety record. And what else? Itraconazole, in retrospective studies looking back at patients with women with ovarian cancer and recurrent breast cancer, taking itraconazole revealed significant increases in overall survival. What is this telling you? And there's much more, but I don't want to do just a talk on cancer. This is for women. That means that molds and mycotoxins cause cancer. And if you treat the mold, it kills the cancer. That is the conclusion that these studies, published studies with medical and scientific evidence, show. Now, people send me this all the time. The ERMI test. I did an ERMI test on my home. Look at the date from this government issued, the EPA, August 22, 2013. They said, don't use it. We developed it to see if it would do anything, but it doesn't work. You shouldn't use this test. The other tool that is very helpful, if you as a healthcare professional want to wonder, well, could this patient have, instead of Lyme or chronic fatigue syndrome or fibromyalgia or whatever else, could this patient be suffering from mold and mycotoxins? I developed a patient questionnaire 35 years ago. The first 2 pages are symptoms commonly found in patients, suffering from molds and mycotoxins. And the patient scores the symptom from 1 to 10 and writes when did it first start? Okay. The entire questionnaire is 18 pages long because it goes through their entire birth to present. What's important? Were they born cesarean section or were they born natural childbirth, et cetera, et cetera? So here's an example. It's called an immune dysfunction questionnaire. First line, fatigue, 0 to 10. And when did you first notice this symptom? So you can follow them, because when they come back the next time, you just take these 2 pages of symptoms and use them to determine, are they really getting better? Do mycotoxins turn on oncogenes? Absolutely. Do they impair autophagy? Yes. They also affect DNA and RNA. They also cause a lot of oxidative stress. So all those things and many more. I'm just giving you just a short version here. Now, for more information, if you want these published studies, molds, mycotoxins, and their effects in children, or the brain and mycotoxins, and that includes the effects on children, let me know. Send me an email to immunedoctor@gmail.com. If you want any of these 2 published studies, molds, mycotoxins, the brain, the gut, and misconceptions, which was published with me and Dr. Weinstock. Dr. Weinstock is professor of gastroenterology at Washington University in Missouri. And Lyme disease and mycotoxicosis, how to tell between the 2, because the symptoms are very, 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 very similar. So for any of these, let me know, and I'll be more than happy to provide you a copy. And if you have any questions, please let me know. Put them in the chat if you have any. I hope you found this interesting, because the amount of studies on how mycotoxins affect pregnancy, how mycotoxins are found in breast milk, how mycotoxins affect the fetus before birth or the newborn, etc. There's a lot of studies, a lot of published studies on these effects. I've tried to kind of squeeze the juice out of it and give you that part, but there's a lot of studies on this, because it's a worldwide issue. It's not only in the United States. Again, you have any question? Here's one. If you have been exposed to mycotoxins once and then treated, are you more susceptible to mycotoxin illness on the second or more exposure? In other words, is there a cellular scar that leaves a patient vulnerable? That's a very good question. And thank you for asking it. Here's what I have seen in the last 35 years. Patients are ill, they come, they get treated, they're back to the normal self. They'll go to a store, a friend's place, a restaurant, wherever, and within 5 minutes, they will say, I need to leave this place. There's mold here. Now, has there been anything published to that effect? Not to my knowledge, but this is just, so it's not published studies, it's not evidence. And so it's just what I have seen. Can pregnant women and newborns take Sporanox for months? They cannot. Pregnant women cannot take Sporanox. And my husband, IgG and IgE done recently in your lab and are positive, while mine are normal. Yes, everybody's immune system is unique and different. So if I've treated mom, dad, and 5 kids, all living in the same house, all being exposed to the same mold from the same place. And what happens is that you'll have somebody just like you, husband and wife, one will be high, the other won't be. Everybody, I'll give you another example. I remember 2 patients, brother and sister. They were both adults. They're 2 years apart. They were both lab technicians at a major medical center in Houston. I'm not going to tell you which of one of the 2 that are there, but one was fine. The other was in a wheelchair. So anyway, yes, people get more sensitized once they get over the mold. It's kind of like the body is telling them, that bad thing that happened to me way back when, I don't want to have it happen again. So that's a very good question. Should you think your condo is okay and does not need any testing? I don't know. I don't know your condo. I don't know. But I will tell you this. I was educated in Switzerland, and my brother's an architect in Switzerland. We're half Swiss, on my mother's side. And right, cellular memory, right, Dr. Susan. Anyway, my brother's always astounded when he comes to the United States, because in Europe, if you build even a barn, you have to sign off as an architect. A builder cannot build anything without an architect. And the architect has to certify that that building will be there in 100 years from now. Here, condos, apartment buildings, etc., go up in a few months. So I can't tell you whether it needs to be tested or not, because I'm not really an architect or a building engineer. Rather than cellular memory, I think it's more immunological memory, but semantics. Have I heard of treating mycotoxins with cholestyramine? Let me take you back to this study here. Binders. Cholestyramine is a binder. They neutralize aflatoxin, mycotoxin, which are rare, but they're ineffective against all other mycotoxins. So that should answer your question. It doesn't work. Not only doesn't it not work, there's not a single study that says it works. Can you treat mycotoxins with ozone? There isn't a single study that says ozone does anything to mycotoxins. So, and I've had many patients come to me who've had IV ozone, IV vitamin C, et cetera, et cetera, et cetera. Do mycotoxins hang out inside of the cells, or do they hang out elsewhere? Essentially, what they do is they like to get into cells and cause dysregulation inside the cell, especially of mitochondria. So all this stuff that you hear, mitochondrial dysregulation, and take this and take that and take the other. No, don't do the take this, take that, and take the other. Just get rid of the mycotoxins and they won't be affected and the mitochondria will be fine. So they like to get into cells. Yes. They like to demyelinate. How do they demyelinate? If you remember basic neuroanatomy and all that, myelin in the brain comes from one type of cell, oligodendrocytes, and in the peripheral parts of the body, it's made by Schwann cells. Well, what do mycotoxins do is they destroy oligodendrocytes, but by destroying their mitochondria. And so you don't make myelin anymore. So they hang out inside. Destroy the cell, then go into looking for another one. And remember, there's 0.1 microns thick, so size of a virus. They cross the blood-brain barrier and then destroy the blood-brain barrier. Any other questions? Okay to take glutathione with low levels of, or is that dangerous as well? Any glutathione will increase and become more toxic if you take gliotoxin. Okay, yellow level is already positive. Okay, it's already a positive level. If you look at the test results, let me take you back to the one that was sent by a patient. Okay, you see this gray, light gray line column here on the right side, on the right test result. This light gray column is normal. So you can't have any. You have to be oops, sorry. You have to be in the gray zone of gliotoxin, and this is the part that's gliotoxin. You'd have to be in this gray part. Okay. So if you're beyond the gray part and you take you take glutathione, you're going to increase the toxicity of that gliotoxin. And in 35 years of treating well over 15,000 patients, I've never used glutathione, just to let you know. But it's very popular on the internet. Remember what President Abraham Lincoln once said: don't believe everything you read on the internet. Any other questions, folks? NAC would be dangerous too because it's a precursor for glutathione. Anything to do with glutathione, you don't want to take if you've got gliotoxin. Now, if you don't have gliotoxin, it doesn't matter. But there's no evidence, medical or scientific evidence, that glutathione does anything for molds or mycotoxins, by the way. That's purely a myth on the internet. There's not a single study. National Library of Medicine has over 35 million studies. In 35 million, there's not one on glutathione doing anything to either molds or to mycotoxins. Any more questions, folks? We're getting to the bewitching hour. On average, how long do typical patients treat with itraconazole? 6 months. Yes, daily. Actually, the dose is 100 milligrams twice a day. And usually you take it with a little bit of food, like, I don't know, just a bite of an apple, a bite of a banana, because it absorbs faster if there's a little bit of food in the stomach. You're very welcome. Everybody have a lovely week too. Have a splendid time. And I hope this gave you the information you were looking for. All righty, folks. Goodbye, and see you in next Wednesday with methylene blue. Oh, okay. This is this one doctor is pushing this because he has a pharmacy as well. Okay. Methylene blue works intravenously in certain types of candida. So there's over 400 species of candida. It only works in 3 of them. I hope you understand. Interesting. All righty, folks. I guess any more questions? All righty. Well, everybody have a great rest of the week. Take care, and I'll see you either next Wednesday for tea time or in 2 weeks for another webinar from tonight.